Welcome to the FT and WNS webinar on the CFO's agenda in the life sciences and healthcare industry. I'm Hannah Kuchler, the FT's global pharma correspondent. There's probably never been an easy time to be a CFO. Certainly looks like a tricky job to a journalist like me. But these are truly difficult times to be in finance at a life science or healthcare company because of the kind of news I cover every day. CFOs are juggling short to medium term disruption because of the pandemic with longer term changes in payment models and technology. The Financial Times, in partnership with WNS, is honoured to host this exclusive virtual webinar for senior financial decision makers of health and life sciences companies from across Europe and the US. So, good morning, good afternoon, wherever you are. First of all, I'd like to introduce Jeff Heusen, who's the Senior Vice President, Finance and Accounting at WNS. He's going to give us a little bit of an intro before we go to the rest of the panel.
So warm welcome to all attendees and esteemed panel speakers today. It's our pleasure, along with the FT, to discuss what next for CFOs in the health and life science industry today. To start, we conducted a survey that I think is a useful pointer in the direction of CFOs are taking. We sort of surveyed 300 CFOs from North and South America, Asia Pacific and EMEA from 20 industry sectors. And in the short term, we're finding that CFOs are focusing on building the robust work from home models, evaluating adoption of digital technologies, addressing liquidity issues. And then we've got the longer term themes that are emerging around reviewing operating models, service delivery models, flexibility, driving mergers and acquisition to completion successfully, completing digitization and enterprise-wide initiatives. So how these will be managed and controlled by the CFOs will be things like touchless processing within the finance and accounting area, liquidity, working capital, control, compliance, governance, asset utilization, and so forth. So what it's all pointing at and saying is that enterprise-wide and CFOs are at this steering wheel at the moment. As a strategic advisor, and how do we navigate the business? So the idea today is to explore the CFO of healthcare and life science industry, what challenges we're dealing with, what your priorities are, and how you're dealing with that. Thank you.
That's great. Thank you so much, Jeff. I think that gives a brilliant overview, and I like the term, the strategic advisor. It's not just about holding the purse strings, it's about giving direction to the company during these tricky times. So everyone in the audience, please be thinking throughout for potential questions that we're going to go to at the end. We love to take your questions, and I'm sure you'll have many because we've got such a stellar lineup of panelists here today. I'm delighted to welcome them. They represent many different perspectives from across the industry. So we have Michael Breslin, who is the Group Senior Vice President, Chief Financial Officer and Treasurer at NewYork Presbyterian. Jessica Federer, who's the partner at Boston Millennia. And Daryl Veach, who's the Senior Vice President and Chief Financial Officer of Highmark Health Plan. So thank you all so much for joining us today. I'd like to start by asking you a little bit about what you do and how COVID changed it. So I'm going to go to Daryl first.
All right, thank you, Hannah. I probably have a better story than most because I changed jobs April 6th of January of 20, 1 week before we sent everyone home. I did spend 7.5 years at Healthcare Service Corps, another large not-for-profit. So I went from one large not-for-profit to the other, but immediately started working remotely. And again, I was actually hired in as the chief actuary and promoted to CFO. I call it my first ever virtual promotion because it had only been in the office a couple of times to the CFO role. But we are, and those who don't know Highmark, we're not just a health plan. We're in several states. We just are in the process of affiliating with part of New York, the Western and Northeastern New York plan. But we also have a health system in Western Pennsylvania, Allegheny Health System. So we actually have sort of a shared view and see both sides of the equation. And actually during the pandemic, it helped us because as those on the provider side know, right, they were hammered by low volumes, liquidity issues. We had the same thing with our health system. But the flip side of that was the health plan saw less payout. Premium stayed, the same, although we did do pretty generous refunds as a not-for-profit. But it sort of helped mitigate the effect by having both sides of it. And for us in particular, the health plan's larger than the system. So somewhere around a 3-to-1 ratio, we benefited more than we failed. Now, that being said, COVID is now, we're almost living with it, right? From the panic of trying to estimate the impact to both sides of the equation, right? The health plan, what do we think was going to happen there? We saw the drop in care. When would it come back? As you can imagine, the health plan's conservative. My actuaries would say, of course it's coming back. It's never going away. And so we were very conservative. On the hospital side, it was a little more conservative there too. It's never coming back. It's going to be a permanent reduction. Truth's been somewhere in between both of those. But I will tell you that if you going into that pandemic, the number one strategic issue was affordability. And I think if you across our whole industry, and it feels like we've had a respite from that, right? We're dealing with these urgent issues, the disruption, if you will. Yet we're going to come out of it, I think, with some of the same issues as we talk supply, and for I'll call us a regional, one of the larger, but still a regional health plan. If you think about the demands for capital and investment, it's huge because we have to expand our footprint. So we have to, if we're going to scale and continue to be a player, we have to continue to affiliate either with other Blues or do other acquisitions to increase our size and scale. So we also want to grow organically. We can't give up on our current markets, right? We have to grow there. And then we have I'll call it a mandate to improve the system. The system isn't sustainable just by getting bigger. So we, particularly since we have a unique view across hospital and payer, how can we work together and make affordability a reality? And I call that reinventing healthcare. We do, Highmark, because it has to be different than we've done it before. It has to be in partnership with the providers. It has to use data in ways we've never used it before. We have to use technology, the new devices and the things you can wear on your wrist that give you information. So we have that. In the meantime, our health system is in dire need of capital infusion just to survive, as well as it has to continue to grow and make sure it's keeping up with the competitors as well. So we have quite a demand on capital. And by the way, we know we're going to go into serious discussions with the providers who've been hurt by this that we don't own, right? That are going to have demands for bigger increases, things that may not be consistent with affordability long term, but may be needed short term. So.
Well, Michael, I see you nodding there as a provider. Why don't you tell us what you do and how you had to change during I think Daryl called it the initial panic and the aftermath.
Sure. Thank you, Hannah, and thank you, Daryl. So New York Presbyterian is a $10 billion not-for-profit health system with 10 campuses across the metropolitan New York marketplace. We're the teaching center for 2 Ivy League medical schools, Cornell University and Columbia University. So a pretty special place that has a 250-year history in New York. We were the epicenter of the epicenter in wave 1. We saw our first COVID patient on March 1st. The numbers doubled, and by March 16th, we had to stand down any all elective procedures. We were essentially a COVID facility, with the peak being April 16th of 20, where about 2,600 of our 3,500 beds were filled with COVID patients. We had to triple our ICU capacity. We had to get 3,000 apartments for our employees and staff to live in. We had to secure transportation and buses to get them into work. As Daryl mentioned, we had to rethink everything. We went into this pandemic a pretty well capitalized institution, but when you're using masks that on average you used to use 4,000 a day, and all of a sudden you're using 110,000 a day, they used to cost 6 cents a mask, and then they were costing dollars a mask. Our lines of credit weren't sufficient, so we had to go out and expand and extend our lines. In August of 20, we did a financing. So the one lesson is there's just never enough cash, right? And that was just to get through the pandemic. And as Daryl said, now we're dealing with the reality of this is now a much more ambulatory centric reality, right? We need to have more access points throughout our marketplace. So that's capital investment. We need to really leverage, all the data that providers like us, have in our electronic medical systems every day. And again, that's a capital investment. So the pandemic, no question, accelerated. It was a catalyst for remote work. We too sent 15,000 people home, overnight. We also had to figure out how to prepare differently, right? So 2 or 3 days of gases and materials on hand was no longer enough. And now we plan and assume 90 days above the peak levels. So we now have protective equipment on hand that's at levels of 90 days than the worst day we experienced in April of 16th of 2020. We also had to figure out, once the pandemic, kind of spread across the country and everyone was now short on staff, where are you going to get the staff? So we had to rethink relationships with our former employees who retired. We had to rethink relationships with staffing agencies. We literally helped stand up a staffing agency just to kind of get retired and form a military paramedics to help us. So it was literally, it was the reality check. It was rethinking everything we do in terms of how we do work, how we pay for work, how we get the staff we need to do the things we need to do. And the journey continues. And again, to Daryl's point, that now means, very, frank conversations with, the government about support and relief, the payers, other providers and social services entities. One of the real stark realities of the pandemic was that, unfortunately, there are health disparities and inequities, and folks don't all have access to the same levels of care. So we need to seize that moment and make that change as well, and that comes with capital investment. So, we continue, as Daryl said, we continue to live with the pandemic. I don't think it goes away. The good news is we're in the hundreds of patients in our hospital today, as opposed to the 2,600 back in April of 20. So it's manageable, but it still has taken its toll on the staff and providers. And we're seeing, retirement and burnout at levels we never have before. So just working through those realities is kind of the new normal.
It's great that the numbers of patients have dropped so much, but you're definitely laying out some of the themes that we're going to touch on today, like how we sort of change supply chains. And Jess, you obviously come at this from a very different angle as an investor, but it did, of course, change that world completely as well. Tell us a bit about what you do and how COVID changed it.
Of course, Hannah, thank you. So at Boston Millennia, we invest in healthcare and life science companies that, improve what we do. So while I'm not a CFO, we work with a lot of the CFOs, both as LPs, but also as customers of the companies that we're invested in. And then previous to this role, I was the Chief Digital Officer at Bayer, or Bayer, if you're in Deutschland. Of course, there, the CFO was truly a partner in creating change, because a digital transformation in a 150-year-old company with 120,000 employees, you can't do that without a really strong CFO partner. So to the question you asked about how the pandemic changed what we do, from an investing side, the demand for decentralized options, for decentralized care solutions, both in terms of video and home care and technology, that demand was so great that it actually shifted the risk paradigm that we usually see in healthcare and life sciences, where there's a real aversion to just diving in. You do death by pilots and there's very incremental adoption. What we saw with this pandemic was that the risk of not doing something was greater than the risk of doing something. And so we saw a tremendous shift in the adoption of these decentralized technologies that enabled research and care to continue in a new way. And that's changed the whole landscape now for what we will see going forward. That's now, we've proven that it works, and that it's here to stay. So I think it's made a lasting impact on how we've changed, how care will happen, how research will happen, and the role of real world data and data from the home and data from consumers, how that will play into the future of those two fields.
That's great, because we are also going to talk about the opportunities and to sort of use this crisis and make the most of the disruption to benefit patients in the future. Jeff, of course, you gave us a great introduction to the session, but it'd be lovely to have an introduction to what you do and how you have sort of experienced the last couple of years.
Yeah, of course. So first of all, WNS is a leading business process management company. So we take deep industry knowledge, deep domain with technology analytics, and we work with our clients, which we're in a privileged position to do because we can go across sectors and we can move across different solution areas. But my role primarily is focused with finance and accounting. So I sort of lead the co-creation delivery of like that entire spectrum of business process management services in finance and accounting. And so if we think about the unique business challenge of healthcare and life science CFOs, there's been a real shift with the way that you reimagine, transform their outcomes through the things we've just heard, but with that operational excellence lens as well. So I'm sure there'll be questions coming up on how do you have an agile operating model, etc. So COVID has really, in summary, has really impacted the way that we architect client solutions. So the CFOs expect for us to play a more active role in providing support in strategic areas now, such as designing and actually executing that transformation roadmap and changes that they're experiencing. So beyond that sort of first case operational support.
Great. Well, I'm going to ask you to carry on and go to the next sort of question, which is this idea of opportunity. I mean, what do you think? I mean, obviously, we've got a huge range of different sides of the industry, but some of the big opportunities to sort of use new tools to solve the small things, the short-term things, which are not necessarily small, but also help with the long-term changes. Yeah.
Could I just sort of start on the biggest challenges? Let me just sort of carry on with the big challenges, and then I can sort of envelope into those opportunities, if that's okay.
Cool.
So business process is not currently is not sort of complemented with the operation process. We're not as we're moving at such a fast pace, the limitation is in agility of that operation process that complements it. So one, there is how do we create agility in the most important component to complement that business change? If not, I might, for example, I might get an order to create a new product, but setting up that product, I might need 1 month to create that operational process, then we've missed the boat. And that's how the sort of the competitive market is out there. And the second is the enormous amount of supply chain disruption that's caused challenges. And this is the planning challenge of long and short term. So we're seeing that you may have to invest more in creating vaccines, like the whole infrastructure, for example, then the ability to get back to plan and to plan that working capital. So how do we strategically plan and make those decisions on how to create capital structure and how to provide enough funds to keep that supply chain intact, as we've heard, without losing any money? In fact, how do you make money out of it? So that supply chain disruption, particularly in life science industry, of how we fund through the supply chain. Secondly, the operating model is not agile today for most organizations. So thereby we need to think finance altogether as a different perspective. So in terms of how do I create that persona-based agility, which helps me get there, and whether it's a technology or complementary operational process to that business process. So what are the opportunities? So the CFO needs to, one, acknowledge the landscape is changing, and it's changing very fast indeed. So I need to worry about if my product will run out of its life cycle sooner than planned for some reason, and I need to embed new age tech possibly in the way my medical devices or the actual medicine is delivered to patient care. So what that translates to is the opportunity to partner with a business as a strategic business leader, as I opened up with, and deliver that business impact, whether it's working capital optimization during the launch or the revenue cycle, which is being highly sort of automated and driven through machine learning, payments, demand forecasting, improving experience, which is a key area in and outside the organization. It's also around agility and adapting to changing environments. So there's this operating model shift, the speed of decision making, adopting digital, minimal manual processing, information transparency, data insights from the analytics piece that I think we're going to talk about later, and then funding, having the funding to cover all these transformational activities that are taking place.
Yes, having the funding is very important. In fact, Jess, you made this point that when you were at Bayer as Chief Digital Officer, you worked very closely with the Chief Financial Officer in order to try and get what you wanted, but obviously make a good case. I mean, what do you think the opportunities are at the moment for businesses trying to make the most of this change and also adopt more digital capabilities?
That's a great question. The opportunities are tremendous, and that puts quite a burden on the CFOs. I mean, as Jeff just laid out, it's basically putting the pressure on the CFOs to be the conscience and the voice of pragmatism between the visionaries that are saying, here's what your supply chain could look like, here's what your operations could look like, and here's the investment that's going to be needed, here's the time that it's going to take. And the CFO is in that difficult and challenging position of needing the data to know what is really feasible, by when, with what investment, to be the balance to the incredible visionaries and technology adoption that we're seeing now. Because yes, we can, but at what cost and how long, and what does that really mean to the CEO and to the board? And that's a really challenging position for the CFOs, because it's no longer enough for them to swim in their lane and be the best CFO. They have to understand the market changes, how the customers are changing in their demands, understand the pipeline. It's not an easy time to be a CFO, but it is a tremendous moment in time to make those pivotal changes that can impact the trajectory of an organization for decades or centuries, and make those changes sustainable. And I think that's the real challenge and opportunity. Is there's so many opportunities right now for a CFO to advance. Which ones will really be sustainable in the organization for the long run?
Yeah, that's a really important point. Daryl, you laid out some really immense challenges that you're facing both recently and the prospect of resurgence of concerns about pricing, etc. I mean, how do you think that you see these opportunities and making those choices that Jess says, not kind of you can't give the visionaries everything that they want?
So I look at it as we've had a big disruption, and with disruption always comes opportunities, and I suspect we'll look back, a few years from now as this being an inflection point. And I'll throw a couple of examples: the delivery of care, right? The ability to provide services either telephonically or over the telehealth exploded, right? Particularly on mental health, which has been a sore spot for our industry, trying to find ways to deliver efficiently and have good quality outcomes. And all indications are that's been much more successful than and more accelerated than it ever would have been without the disruption of COVID. And I think that's just one example. Because I am on both sides of the supply chain issue, but I think that's an opportunity too. And it's a balance from a CFO standpoint. How much do you invest just trying to fix things back to the way they were, right? Which is immediate need patients need care, beds need to be staffed, right? And by the way, the demand, and whether it's deferred care, or there seems to be a demand for every product that anyone's selling these days, but healthcare is no different. The demand is exceeding the supply right now, particularly on the elective side, and yet we're having trouble staffing the beds, making beds available. It's exacerbated by patients that are in beds and have no place to go, long-term care, skilled nursing facilities, or have the same capacity problems. So, but to me, that's an opportunity, right? Or is there a better way to do some of this, right? And so I think the balance of spending your energy, getting data, finding out what has to be delivered by who, and what has to be in the hospital versus virtually in the home versus an outpatient, although those are all booked too, but where do you place your bets, right? And so I call it a balance, and as organizations the size of ours we can't give up on the current model. We have to keep it going, but also make appropriate investments in the way we do it in the future. And we're making both and stretching ourselves a little. And again, we have the advantage of being a not-for-profit, so we can do that. And don't have to balance delivering to shareholders. Still have to make a margin, but we can make some of those critical investments. I also think it's more important than ever to do those with providers, and we have a strategy trying to, even where we don't have ownership of providers, having provider partners so that we can work on these problems together, get the volume they need to survive, but make sure it's the right volume and delivers the cost and quality that, sustains affordability versus exacerbates it. So I think that's a big opportunity. A lot of times it's the same, give us more money, and we say no, and the back and forth. But I think this is going to force together. And again, it was a trend that was already going, but I think it's going to accelerate the need to create models between payers and providers that are different, meet the real important person who is the patient, the member, right, that needs the help. So.
Yeah. So, Mike, how do you get that balance right between fixing things that are broken, maybe things like your, huge stockpiling initiative in order to not find yourself in difficult situations, and doing these new ventures? And maybe I can also tack on to that. We're going to sort of talk a little bit about digital capabilities in particular, and where do you see them falling short, or how do you see that you needed to adapt to sort of reap the benefits from them?
Sure. So we're in kind of an inefficient period right now, right? We are stockpiling supplies, and we are short and back ordered on supplies, right? So what we're trying to do is squeeze efficiencies anywhere and everywhere we can. And finance is ripe for the picking, if you will. We do hundreds of thousands of routine transactions every day. So we're talking about, what else and how quickly can we accelerate robotic process automation, automation in general, because again, we do need to make those investments. We are right now focused on what we're calling a frictionless patient experience. We literally want the patient to find a provider on their phone, schedule their appointment, get a virtual meeting with their future care team, virtually tour the facility they may be coming to, pay their bill and complete their survey all from their phone, right? We want this to be seamless. This is about, again, tearing down any barriers to access, because at the end of the day, we can't cut our way to this. This is going to be about growth, and we're all kind of doing the same thing. So it's going to be what can differentiate us. And I think it is that digital investment. So to us, it's, tolerate, no inefficiency, squeeze out everything we can to make sure that we're investing smartly in the things that consumers need, demand, want going forward. We have what we call our Imagine journey. We commenced it before the pandemic, but again, the pandemic just accelerated everything. And it was basically our initiative to digitally transform everything we do. So, second visits, you'd rather that be virtually than somebody having to come back into, the facility. We're putting handheld devices, right on our phones, so that the next time a nurse calls in sick on a unit, instead of a nurse, a unit clerk, manning the phone trying to find somebody to fill that, a text goes out to a broad base of nurses who can say, oh, I can fill that unit. I'd like that overtime. And again, we'd like to be to the place where, it's seamless. You get a single bill with any and all providers that serviced you on one bill, and you can pay that bill by phone. So to me, this is, again, squeezing out inefficiencies everywhere and anywhere you can through digitization, and then making sure we're investing in everything that puts the consumer at the center of what we do.
Yeah, that's great. And actually, it really brings me on to my next question, which is about things like automation, machine learning, and AI. Jeff, I wonder if you could, I'm going to be naughty and already take a question from the audience because the good ones are coming in. One of the audience members says, is it worth investing in digital and the use of AI? And to which I would add, because I'm pretty sure you're going to say yes, and why?
Yeah, I mean, so if we before we get on to what next for the capabilities of digital, right? If we think about first where digital capabilities are falling short, we can talk about that. We can talk about what the CFOs need to do to reap the benefits of digital. And before I sort of answer that question, I think we've got a growth opportunity here that's staring everybody. The CFOs become an advisor to the business right now. And another dimension to become actually helping manage the performance of the business. So in my mind, there are two things here. It's all about data. Okay, so you can put lots of this digital wizardry in to try and make the processes more efficient, more effective. But I would say that the biggest challenge is, before we move on to implementing digital and AI, is elevating themselves and having that conversation with the organization, which is business performance centric, in that they don't have robust data, and that the organization is confident in them being able to bring insight on the one hand that the CEO trusts, and on the other hand, the business can't refute. So, to the challenge, as the business builds their own dashboards and they can always explain how they're doing a great job and everything, I think when you add it up, and I guess it doesn't add up to the enterprise doing a great job. So if there's a mismatch, you'll have this whole issue of a single version of the truth. The watermark data is a really good data quality, and sustaining that and doing that in an agile way. So as business unit structures evolve, mergers and acquisitions happen. You don't need to throw it all away and start again. So really, this is about how do you achieve an adaptable performance management platform where people can rely on the content and adapt to the changing shape of the business so it remains relevant over time. It's that message of sustainability. And once you've got there, okay, it's we then talk about what the next level capabilities like this hyperautomation things are. So we've seen generally large and mid-sized companies, and they've all done significant investments in systems and data and analysts and data scientists. But still, if you ask the leadership team, they're under leveraged and they're not getting value of the investments they've done. So our assessment in finance at the moment is around, to actually, how do you get the AI and the automation enabled? Is the data that's sitting on the multiple system that's not fully integrated, sitting on disparate systems, and the data is a big roadblock to enable the analytics to flow. So we at WNS, we have a hyper-automation led approach, which doesn't try to go to one system, one database. It says you are where you are, and there's a connector through that hyper-automation. Then there's data used as a fuel. We term this thing as a fuel, not as an exhaust. So basically it means to achieve real-time high quality and it being seen. So once you've achieved this hyper-automation through platforms like EIQ, you're able for this system to be interfaced, and you're not thinking about functional analytics. So what we see in general is our analysts of each of the functions. So rather than having an individual function creating their own analytics, we've got to think holistically across it. So the CFO in this scenario has a key role to play, actually, in integrating the systems through hyper-automation led approach, which is adopting, whether it's an automation of a process, or whether it's machine learning, or whether it's trying to deal with the unstructured data issue that we've got. So it brings it together and drives towards our position on a finance one office. So, it's really the enabling area there.
Yeah, no, I think that's a really important point to make sure that the whole business is moving together as one. Jess, what do you think about this? how do you make decisions about whether to invest in digital and use AI or hyperautomation?
Well, I love this question. As a former chief digital officer, my answer is going to be yes, now is the time to invest in digital and AI. And the reason is really twofold. It's operations and outcomes. We have reached a point where without technology, we're not doing justice. We're not achieving what we could do as an operation, efficiency-wise. We're duplicating. We're having a lot of wasteful spending, and investing in AI and digital is a way to dramatically improve the operations. Secondly, it's the only way we have right now to efficiently, at a wide scale, improve the outcomes. And we're all here today talking about healthcare because we know that data, as Jeff nicely said, data is now one of the key enablers to having that view in near real time of how do we improve outcomes, looking at care decisions, care pathways, deduplicating care, and how do we improve research, getting that data in near real time from multiple sources and auto-syncing it and having the source verification. So these investments in digital and AI are, in the short term, right now, improving our reach and improving our operations. But in the near to long term, they hold the key for improving outcomes among the patient populations we serve and among our families and community members. And to use some of the examples we're seeing now from regulators, the FDA and EMA are working now with real world data to make regulatory decisions. And if you think of where we were 10 years ago in drug development and discovery, just imagining that we would be able to use real world data and synthetic control arms to get an indication for a new product, for additional indication for a product, that was a holy grail concept. And now the data is accessible in a way and traceable in a way and is in a good enough quality for the FDA to accept it, to give these indications. And that means patients are getting drugs faster without needing to wait for additional long randomized controlled trials there and without the huge investment that's needed for each of those trials. And all of that is coming from the technology and the data. So yes, it's worth investing in, and now is the time if we look at the environment and the regulatory changes that we're seeing.
That's a great pitch. I've never seen someone so excited about synthetic control arms, but you make a good case to link it to the outcomes for patients.
Thank you,
Anna. I'd like to go to Mark and then Daryl now for the next section, because we could actually talk about digital for the whole rest of the time, but we don't have the whole rest of the time. But I want to make sure that we do touch upon some of the changes that are going on in payment models, because they're of course incredibly important to the whole industry and particularly to the CFO. I mean, Mike, how does that affect what you do, and how do you start to adapt your your organization to face these new models?
Yep. So, we've got to be nimble, and we've got to react to what the market is dictating. In our market, it's still a predominantly fee for service, but it's a variation in terms of upside or shared savings as opposed to full risk. We haven't, in the market, we haven't seen a whole lot of, all on full risk of late. With that said, a number of years ago, we partnered with our two medical schools to form an accountable care organization. And we've got 38,000 Medicare fee-for-service lives that we're responsible for. It's about $500 million of spend a year. And we have tremendous success. So we invested in the digital tools. We've invested in the care management tools. And we're one of a select few of the organizations that for the last 4 or 5 years have gotten just about under $50 million of shared savings payments. So we've achieved the government's benchmark and then some. So we're seeing some big return on that. But the real purpose for doing it, Hannah, to your question, was to prepare for the future, right? Could we do this? How would we do this? The beauty of the program was that this, again, was kind of, sharing in savings as opposed to downside risk. So we got to learn with kind of training wheels, before the market turned. So, that's what we're doing. We have pretty progressive, quality metrics with our payer partners. But again, the market to date hasn't demanded full risk, and it's not something we're going to run into. Something we're going to certainly learn how to do before we do that.
Yeah, that sounds like a wise approach. Daryl, do you have any training wheels projects?
I would love to help, Jeff. And actually, be honest, we are probably a little farther along, certainly in Pennsylvania, maybe a little less so in the parts of New York that we're in. But and again, it is our view isn't to force risk on providers when they're not ready for it, because that's usually a bad outcome. Our view is to ease them into it. So we also have a lot of value-based arrangements that have upside, and what we typically like to do is replace sort of guaranteed fee increases with opportunity to earn, and that can be upside but still move in the right direction, if you will. So but we are wanting to move to upside downside, to try and align what the health plan has to deal with in terms of pricing and competing with what the system has to deliver, right? Because as long as it's not aligned, then you continue to have leakage and conflict and suboptimal results. And this will go back to the digital question. I think the biggest gap right now for moving forward, getting providers more comfortable with risk, and I think this is more on the health plan, although I think some of the bigger systems are doing it as well, is the data. So we have to use data. I'm not so sure about AI yet. I like real intelligence over artificial for now, and that's in scarce enough supply for people that understand the business deep enough to make use of the data. We probably have more data than we have people who can use it and draw good conclusions from it. But I think that's key in a good partnership. So the health plan has access to information the provider system doesn't, about where individuals are in their health journey. What are they not doing that they should do? Who needs to have a visit to, prevent a major illness? So I think that's, if I had to and we are, pick a place to invest, it's in our data, but data for a reason, not data for data's sake, right? The data is all about getting that member in the best health, to give them the best care. And to do that by partnering with the providers and sharing that data, in spite of all the regulatory restrictions on trying to do that. But there are ways to do it, and we're getting better at it. So I would say, again, data for the right purpose, and getting that shared alignment. And when providers have that and they know they're being supported, they know they're getting the information to get the right revenue, they're getting to get the cost under control, and they know they're getting that partnership, then the upside downside risk question is easier. So
yeah, that makes sense. So Jeff, you have an overview when we're talking about using data to understand new payment models and adapting to it. What do you see as sort of the gold standard, if there is one yet, if not everyone has their training wheels on still, that idea of how we connect stuff up. Oh, I think you might be muted as well, so time for unmuting.
Was that Jess or Jeff?
Jeff, that was Jeff, and I can hear you, so excellent.
Okay, yes. So payment models, right? So I mean, the way the way to tackle this is, if we think about the shift to value-based care, which we've just heard. I mean, it's just building on what we've really heard here. Is it's leading to other changes in the operating model. So, as being a CFO, and you're managing a whole new cash flow cycle, you've got a whole different forecasting commitment, where we're moving from traditional, more predictable patterns to more longer-term commitment to provide the end goal of incentivizing quality care. I've sort of mentioned before, but it does come back to how we improve the experience of the end user, and how we actually manage the operation with analytics. So how do we know whether a certain milestone has been hit? How do we know whether a certain service has been delivered? So I'll just want to come back to this thing around what the fundamental, digital capability falling short that then therefore links back to value-based care. I met a CFO recently, and there's a fundamental problem. One is where people were looking for reports, and he said that they moved to SAP 4 HANA, but he has an issue that the team does not know what to use or how to use it. So we have two problems. One is the company doesn't have the inputs or analytical capabilities to provide the inputs. And the second is about which reports and what to interpret. So as a finance office, when you have these two problems, you then suddenly dig into it. You suddenly realize that the future of how the finance organization is around the skill sets of the organization itself. So this shift toward different payments models, we're seeing it in all sorts of contracting through the supply chain, is where there is a need for finance staff as data analysts. And it goes back to how do we move finance staff and upskill them into data scientists? And if you're going to ask your data analysts to make inferences, it's better to have your finance team to upgrade their skills to understand and become data scientists than the other way around. And as we've heard before, it's complicated. And how do you manage the cash, and how do you get the right insights and the right reports, and how do you interpret that data? Okay, so progressively over the next 3 years, CFOs have to invest in their people as much as the industry is changing toward outcomes to drive that interpretation and that analytics end to end through through the pharma and life cycle and healthcare system.
Yeah, that's a good point. Well, okay, so we have a lot of questions, but we don't have a lot of time. So I'm going to go, this is going to be a last question. I'm going to go to everyone, but I just want a 2-sentence answer if possible. It's going to be like a game show. So the question is, and very important to end on, how prepared are we for the next pandemic? So I'm going to go to Daryl first.
I think we're better prepared than we were going into this one. And in fact, I would even say we had a little, the Delta variant was a second version of that, and had a little less deferred care, a little less, harsh shutdown for elective surgeries and such, but it still created a lot of the same problem. You filled up a lot of beds, and some in the non-vaccinated states more so than others, but you filled up beds with COVID, and therefore the elective care got pushed out, and it exacerbated staffing issues. So I don't think we're all the way there, but again, I think it's incumbent on us, certainly as a health plan, to prepare. I think the health systems, and as we have discussions with the health systems that were hurt the first time around, it's actually a big vote for shared risk, right? And that either direction. So if it goes the other way and there's a bunch of big costs, and the systems would benefit, because we could have a pandemic like that didn't shut down services, it would help the health plan. Or if we have another one like this, again, the model we had in Western Pittsburgh, where we, one traded off the other, I think it's more reason to integrate the financial outcomes of the payers and the providers to prepare for that financially. Now, there's a whole lot of other things that we can't
You've taken
anticipate.
more than your 2 sentences.
Sorry.
And I'm allowing you because you have this, you have the system and the provider point of view. But everyone else has to stay to a couple of sentences. Jess?
Not prepared enough. As a nation and as a global community, the investment in public health needs to increase. There was a great article by Ed Young in The Atlantic this week, if you haven't seen it, on the need to revitalize and reinvest in our public health infrastructure. Let's be better prepared the next time.
Excellent, thank you. Yeah, man, good recommended reading. Mike?
Better prepared than we were. I think the problem is you've seen one pandemic and you've seen one pandemic, right? So we just have to be more nimble. From our perspective, that means anticipating, but also flexibility in terms of converting beds and rooms into ICUs, having the equipment we need, and you just can't afford to have it all at the ready all the time. So I think we're much more better prepared for something that looks like COVID next time around. But again, you don't know what you don't know.
Jeff, what do you think?
Yeah, very briefly, I think we've learned a lot, right? We know we've got challenges ahead. I think this is a great opportunity to become a partner to the business. We do have this skill shortage. We do have the key analytic shortages of staff. I think we've got to think about this as a sustainable partnership long term for healthcare organizations to drive transformation, not just as a project, not just fixing the now, but I think longer term. I think we've got some way to go to actually drive upskill, use analytics, think about hyperautomation in the sense of the sector we're looking at, to really, in a long-term partnership way, to drive the sustainable robustness we need if there is and when there will be another systemic change in the supply chain.
That's a good summary. Well, thank you all so much for sharing your insights with us today. I found them incredibly interesting, and I'm sure the audience did too. I mean, just to summarize, I feel like some of the great points that you made included, Mike talking about how you can't cut your way to the future, and then Daryl pointing out that it's kind of tricky because you have to balance repairing what went wrong during the pandemic and this kind of revolutionary change. Jess made this great point about CFOs and chief digital officers working together, how you have to balance the books and the vision. And I quite liked what you said about how without technology, we end up just wasting more. So it's certainly a good place to invest. And Jeff has talked about how this is actually a growth opportunity, and the chief financial officer can play an important role as a strategic advisor. So I'd like to thank all the speakers and thank the audience for joining the FT and WNS, and I'll see you again soon.